I'm the director of the Bradford Institute for Health Research. I've been running a study called Born in Bradford for the last 15 years. And it's an NHS-based study, but over the years, we've realised that most of health is determined through schools and education. So moving away from hospitals and NHS, we've really started working with primary schools initially and now secondary schools. We're going into 38 secondary schools over the next 7 years. We're going to be collecting very detailed information on 30,000 teenagers in the city. It's really the biggest study of adolescents in the world, and it's happening here in Bradford. And one of the things, well, there's two things really. First, the importance of how health affects our education, but also how fundamental education is to our long-term health. And there's really good studies showing how educational attainment is so crucial for later adult health. So this is a bi-directional thing. We've got to get good health to get the children and young people good education, but we've also got to set them on a path through their adulthood to healthy lives with good educational attainment. So I'm going to get everybody to introduce themselves briefly, and I'm going to go and ask them a question about what their take on health barriers are, health and education, and then talk a little bit about solutions. What I'd really like is a bit of audience participation. So normally at these things we say, have you got any questions, and everybody's a bit shy. And then right at the end, everybody sticks their hands up and wants to ask questions. So we'll do the first round. While they're thinking, while they're talking, you think about what sort of questions you'd like to ask, and we'll get involved. It's a roving mic. Okay, so first, on my left is John Stir. You're head teacher.
Yeah, so I'm an executive. In the thick of it, I'm executive head teacher at the Carlton Academy Trust. So we oversee a large secondary school in Bradford at Carlton Valley with 1,700 students and a school in Keighley with 750. So we're very much in the thick of it. Our focus around health and wellbeing, our Carlton Valley school's got outstanding world-class status. Yet the biggest barrier to our young people is their health, and the Born in Bradford study has shown us some of the issues around obesity, asthma, life expectancy is a real concern for us. So for us as an organisation,
let's just, while you started that conversation, I was just talking to you before about you noticing this sharp increase in overweight obesity in our children. What are the influences on that? What's happening there? So let's just your school. You said that when you started that conversation, I was talking to you before about you noticed.
Yeah, so if we look at Carlton Valley, we have for 330 places there. We have about 700 students, which means the country area is probably only about 1.5. Yeah. Yeah, so if we look at Carlton Valley, there's a 15 16 graduate for 330 places. They're not being physically active, they're not necessarily going to activities after school. So this year we probably put in consider that money there, which is clubs as 15 every night, and establishing that culture around it. And not we live in the corridor, not just off the main roads, we have much areas this year, we live in every student in that area. It's something for us that has become a real priority. When we see the data, we live in, it's alarming that in a developed country, we have a life expectancy here in the centre of Bradford 10 years less than 10 miles away. Something for us that some rural areas, something that's driving us as an organisation to make sure that we sort of play long-term benefits. We have a long-term impact because we see in technology on a daily basis, some of the health concerns around that, and working with other organisations is how we sort of adapt and rotate and support each other to make a difference. We see that problem as a so the physical health
Michael, working with Michael in terms of for the last few years, particularly on mental health, because that's also another complex condition which has multiple exposures. Tell us about Michael's perspective on this.
Yeah, 100%. I think one thing that people I work with have
particularly on mental health,
I think is just we've been missing the mark for a lot of years in identifying young people don't just arrive at low self-esteem and depression and anxiety anxiety and eating disorders is part of the person's environment. Just part of that environment is their identity, surroundings from home, school, and everything that is in their life, and with their progression, and just about the eating disorders and what we do with our environment. Young people not being able to access surroundings is a big issue. It essentially does, as your study suggests, we need to be able to breathe. Not just about what you eat and interactive from cognitive behaviour, psychology and physiological levels. Poverty is a big issue, because as your study suggests.
Matt, so we have two paediatricians next up, and a paediatric dentist. So this is the clinical side. Matt, introduce yourself and tell us your perspective.
So I'm Matthew Mathai, I'm a general paediatrician.
So we have two paediatricians.
So I've been sort of doing paediatrics for about 25 years now, and when I started doing paediatrics, it was about looking after sick children. And over the years, particularly over the last 2 years, I think my feelings about what paediatrics is and should be has dramatically changed. There are so many entrenched, intractable problems that we have in Bradford and many other cities around the UK that we really should be helped in a way. We need to be looking outside, there are so many help. Looking at school going today, I've been really inspired by the young people. We saw before lunch was we have the power and you have the power. And I think in Bradford there is such a culture of innovation and change, and we've got such amazing young people, creative voices. We've got people like you who are committed to young people, and we've got researchers. The Bradford programme will change the age of wonder in the next 7 years. I just think we're in such a fantastic history. All the shenanigans going on in Westminster at the moment. We can't wait for a particular current government. We have to do things now. And I've been really encouraged by Royal College. We've got Dr. Camilla Kingdon, the President of the Royal College of Paediatrics here, who's really committed to creating the equities for health. And that's what we want to talk about in health. And I've been wanting to talk about how do we create these equities across the system, working with schools, working with social care, working with justice, and working with you guys, all you guys, and we want to make it better tomorrow. How do we create these equities across the system?
We do have
working with
the
schools,
President of
working
the Royal
with
College
social
here,
care,
Camilla.
working with
We're going to ask you to sing a song.
But
But before we do that,
to make it better.
extra one, we have the power behind the throne, which is Megan. So Megan, to you.
Hi everyone, so I'm Megan, I'm Head of Quality Improvement at the Royal College. I actually was a young, upstart paediatric trainee in London, and I actually left paediatric training because I burnt out and I lost my purpose. So working 90-hour shifts in A&E, seeing the same families come back to you over and over again, saying I live in sheltered accommodation or I live in these conditions, I need help. And as a young junior doctor, just saying I don't know what to do. My seniors saying we can't help. Speak to the on-call social services team, and it's just felt like we're passing the baton now. And this morning when everyone really said let's run together, I actually felt like, as a young doctor, I felt like I was running a relay, passing the baton on. But every single world-class relay team, everyone's going to draw the baton every now and again. And when a child's life at stake, you feel like we can't risk running a baton even for 1,000 times. And how can we run together? So using paediatric training, joining the Royal College and working on quality improvement, I was trying to figure out how we can run together, not passing the baton, but actually running as a team, and sometimes being the one at the front, and sometimes taking the rest, and I'm really else to be at the front. But knowing who your partners are, and in healthcare, we can't run alone. We are interconnected with education, with the community, the social sector, with corporates, and all of that builds a child's life. I think it's kind of introducing that, discussing that at the Royal College, and also amongst our paediatric community, and saying let's reach out, let's work with our partners, because we're all here for child's life. It's not for medicine, it's not for education, it's for child's health, and we're all at the Royal College, but also amongst our paediatric community, and saying let's reach out, let's work with our partners, because we're all here for child's health. It's not medicine.
I'm Peter Day. I'm a professor of paediatric dentistry at the University of Leeds, but clinically I work in Bradford. I'm a paediatric dentist dental service across the whole of Bradford. So from Peterborough to Walton Park in Leeds. I'm sure you're probably well aware that the oral health of Bradford children is not very good. In some of our more challenging areas, it's almost 1 in 2 children have dental decay by the age of 5. So I'm sure you're obviously well aware. And I totally agree with everything you've happened. But I think the key thing is, if children are at school and there's good data on the most common reason for children to have dental settings is dental reasons. When we do take that time off, they're off for 3 or 4 days at a time. The thing is, children are off school, parents are off data, and there's a significant cost to the NHS as well as and it's really how can we look at things you take like that time off with education, with our other healthcare partners, very much more upstream and preventive approaches. But you hear about all these fantastic opportunities really in education. But if children aren't at school, they're not getting those opportunities. With education, how can we enable children to have healthier, better to hear about a happier smile and to be actually at school gaining all the benefits and not getting those opportunities.
Okay, thanks, Peter. So we've got a range of experts here, everything from teeth to schools. Do we have any other questions from the audience?
And to be actually at school gaining all the benefits.
Okay, right, keep thinking, because I'm going to come out to the audience and ask you. So it's going to be like embarrassing classroom scenarios where I'm going to come and ask the students. So two questions I want to ask. One of my observations is how silent we are as an education. We are smiles and beats. So the first question, two questions I want to ask. Which one you want to answer? How do we strengthen one of my observations become more integrated silent we are? The message that you're all giving us, how important smiles and beats. How do we strengthen that? So the first question is. My second question. Which one you want to answer? One thing I'm told. How do we strengthen? Like, everybody wants a simple message that you're all giving. What's the one thing you would do? How do we strengthen to tackle childhood abuse? My second question. Tackle adolescent. One thing I'm told, and it's a crazy question. Everybody wants a simple question. It's so many multiple exposures. What's the one? There is no one that you have to tackle childhood abuse. But because I'm the chair, I'm going to ask the panel. What is the one thing we would do to improve health? It's so many multiple exposures. So I'm going to start with John. There is no one magic bullet here. Right. No, because I'm the chair. Peter, because that's what the one thing specialties to improve health of children.
So I was just going to choose a couple of examples. We've got a couple of big NIH research. One happens to work with John and that's around secondary school children and whether a simple thing like an oral health lesson and some text messaging can actually improve children's oral health. A big 5-year study we collected the results around secondary school children and whether so that very much shows how oral health text messaging can actually improve children's attention in schools. A big 5-year study we collected the results age groups, so for children aged 3 to 4, oral health and schools has been shown to be very effective up in Scotland, where it is almost mandatory, and importantly, it has the most effect for the children who are most deprived. Schools, so it actually reduces health inequalities, and I totally understand that schools have got so many other things to do. Importantly, it has the effect, but again, it's that balance of a child is a child, so it actually reduces health, and hopefully, there's just a couple of examples of how we can totally understand where schools and education and health do.
Nice examples. You got set bar high, Peter. So Megan, in the centre of power, with your levers of power, what would you do?
So I think, because I was over on the other side of the stage this morning, listening to some discussions, particularly around education, it occurred to me that the future NHS workforce is born in our schools. So you are the ones who are creating the next doctors, the next nurses, and health professionals who will take healthcare to the next level.
The future NHS
and
workforce
I was
is
particularly
born in our
inspired by
schools.
everything today because
So
you're looking at a
you
result
are
of
the
someone who was a pilot of a mini kind of opportunity area. I came here when I was 4, I had no English experience, I had special help from the nursery, so they put on extra hours to teach me English. So by the time I started at school, I was fluent in English. So I had equal opportunities. I was at the same level as everybody else in my primary school, just even before I actually started the education system.
So by the time
I had nobody in my family who was actually a doctor or anything in the medical
so I had
field.
equal
My
opportunities.
first experience in medicine was a teacher in primary school telling me
just
about
before
someone who
I
had
actually started
diabetes
the education system.
and explaining what diabetes
I had
was. That was my first exposure to what a doctor
does,
does,
to
to what
medical
medicine is.
skills.
So I think education and health are interlinked more than we even know. And so, those kind of programs and activities in schools, they are potentially inspiring the next NHS workforce, the next doctors. Education and that's healthy for everybody. And in terms of the last 2 years, what we've learned in healthcare is that we can create and invent vaccination, but it takes education, it takes community to put those vaccinations into everybody. And so we rely on each other, and we can't kind of always be on our separate lanes. And that's really those interconnections, those partnerships with those most of, and use those partnerships
And so
to
we
then
rely on each
inspire
other.
bigger ways of working and more
Always
collaborative.
be on a separate.
Thanks, Mary. So that's a very clear
And
vision
that's
about
really
greater
those
integration.
kind of interconnections, those
Fantastic.
partnerships
That's the question which I'll
and
get to
use
pass on
those
to Matt. So
partnerships
Matt, there's a
to
bit of a
then
vacancy for
inspire
Prime Minister's
bigger ways
position.
of working and more collaborative.
You have Prime Minister for the day. What would you do?
Greater integration.
So I think what I do resign. I think in terms of I think the slide I mentioned about obesity
for the day.
and my special interest is in children with diabetes. When I started working in Bradford 14 years ago, we had very few children with type 2 diabetes, which is usually seen in adults. But really, over the last 14 years, I've seen a fourfold increase in the number of children with type 2 diabetes. And type 2 diabetes is associated with ethnicity. It's also associated with obesity. And there is no, as everyone knows in this room, there is no magic bullet to do that. So I think the previous session again about community engagement, we have to know how serious a problem that is for our community. Is obesity a significant problem? If it's not, then maybe an education piece. But we have to go to it when our children are in the communities, in the schools, in the playgrounds, in the shops, in the fast food takeaways, places of worship. These are where our children are, and as healthcare professionals, we need to be there as well. I think the previous session was talking about reaching dads through hairdressing shops. They need a haircut. We need to be there. We need to be where people are, the children need to be there, and then we can develop these unassailable goals that can only be achieved across the system, not just in health or in education, but across health and education. And once we've done that, we can then decide who are the key actors to essentially address the issue across the system. And then using sort of shared things like governance processes, policies, protocols, operating procedures, and with the know-how of organisations like the Born in Bradford program, we can actually start to see what works, and also why it works, and then we can continue to engage with the community and with the know-how of with the like Born in Bradford.
Thanks for that. So
we can actually start to see what works, and also why it works, and then we can continue to engage with the community and develop things forward.
How do we give
with them
power to?
Thanks for that. So interesting, both Megan and Matt about
One of the big changes
about the sort of population about those
over the last couple of years is a move away from blaming individuals for lifestyle changes and recognition of systemic
one of the big
how we
changes in
the two examples that we talked about are quantum marking out and mental health. I think are both very similar. One around overweight obesity, some molecular complex adverse systemic effects, and one around mental health. Both of these
Two examples that we
are
talked about,
worse
quantum
and
marking
worse
out
in
and
young
mental
people.
health. I think are both very similar. One around overweight
Steadily worse. The pandemic has caused a sharp uptake
Both
of
of these
in these.
worse.
If you look at your national child measurement data for the last 20, 30 years, you look at the levels of common mental disorders, anxiety, depression,
causes
also
sharp uptake.
and it's very heavily socially so Michael, from a mental health perspective, I'm working with the young people that we do. So tell us a little bit about what your insight into this group are.
Well, causes, I'd say it seems to be plain and simply right. It's only something that everyone's done in the last, it's never leaves people to house. Early intervention is something that it's branded around our sector, and we're trying our best to do things at an early intervention level. But what we're actually doing is not actually coming together as a whole system approach that is consistent and is also structured and making partnerships. I think your leader, Susan, and seem to be aligned here really with that. And I have quite a unique role speaking not only to parents and carers and children, but also professionals like yourselves, making partnerships, and it seems to be that early intervention, but nobody has the solution. And my personal feeling is that when a young person's in their earliest years, transitioning from reception and nursery into care, that's when everything should be done, like an MOT healthcare check, an educational health check. It could be blood scans, but if we're not looking at safeguarding and physiological, psychological health, and if essential is not involved in that age at that moment, then more and more people get. It could be bleeding through the net if we're not looking at physical health needs and physiological, psychological health and health needs and families. And we're actually we cause it work from self-down right, and then that's where we're playing the net systems, we're playing because we're always chasing our tail. But if it's all done at once, clear plan coming in, and it might be 25 years from now when people go, actually, we have to look at it now for itself, and impact on it, and then benefit it on future generations. We're always chasing our tail. But what it seems to me at the moment, when I speak to people who do this, it's a sticky plaster all the time. That's all we have now. It's sticky plaster's getting better. It's waterproof these days and everything. And we've got all these just that seems to be at the moment. What we're not doing is going back, further back. And I think you're on the edge of just looking at all these areas that people aren't. You mentioned earlier that people don't just arrive at mental health crisis. There's a long, slow build up to that, and they don't sometimes just arrive at needs. Yes, they are urgently so, and there's loads of factors. You mentioned social media, it's also parenting is also something that is like a grenade that people don't want to hit. We do have to look at ourselves as parents and other parents to support and empower communities. And to do that, the professional help is also something that is like a grenade that people don't want to hit. We do have to look at ourselves as parents and other parents.
Two of the key messages for all the wealth that has come out. Firstly, inequalities of certain mental health. No shit showed up.
Two of the key messages.
Secondly, how everything started pretty much from the day we are firstly trajectories, inequalities, capacity of mental health are diverging in those early years.
No shit showed up.
Tyranny of the urges.
Secondly, how everything started pretty much from the day we are born.
Emergency
Trajectories, rather than thinking about the system, capacity,
that creates this
diverging in those early years.
So John, you're seeing them fairly far down the line, they're young people, but by the time you're seeing them, they're 11, 12, and to 18. What do you think would help?
So John,
lives?
You're seeing them, fairly far down the line.
First thing I changed was the criteria around
What do you think?
create a system where you would judge whole outcomes, not looking at the whole development person. I suppose when you break it down to start what when there's great evidence to show the first thing to change is the criteria of the person's getting with every process. When you're new to a challenging situation, going into a school, without any results. That can be a challenge for say. I think that puts pressure on us as well to prioritise actually looking at first. In terms of what we can do about it, when you're doing some exciting projects out there, situation, part of the going into the area funding, that is showing us. That's our pressure on us. We have a project like Keithville where we're a trailblazer school where we have a mental health working school, working with our students once a week, we work with our staff, our skilled everyone. And what we see is that has a massive impact. Amanda Pritchard was out earlier on this year, and it's a fantastic project that's had an impact. The first question I asked was, can I have students work Bradford? And that's the years down the line. This is that everything's so slow. Great project out to the early next year to make it it's fantastic. But it's too slow. And we look now, the first question I asked was the Road Clean project. We're the hub for the Keithville project, and it's such an exciting, great getting organisations to be able to work together. But I think the previous question I answered earlier, I listened to said, we're the hub, what we need to do with projects together, we need to go to schools and schools organisations, we need everyone together so that we can take away the excuses. There's too many excuses earlier. I listened to parents not turning up to it, students going out, maybe leaving for 10 o'clock and not returning for a whole day. They're missing their education. So we've got to work differently in our localities to all together. And maybe that is having appointments on streets, bringing schools to central students around so that parents are attending, students are still seeing their students, they're meeting the whole families. 90% of the time, the families are not engaging in what we know about. They turn down early school, they turn down school, they turn down home. And they're the ones that are creating stretches the system, and the ones that beat us the most. We've got a 90% of the time to make it no longer an option. But it's showing down to keep showing us we've got to help. We've got to do that the right way. We've got to use that the right language. We've got to make it as making our no longer an option, but giving that to as a system. The system doesn't work rationally. You've got to go that the right way. So opportunity, not seeing more technologies to bring that together to try and help solve future problems and to create a collaborative environment where all agencies are working together for the best of young people. That's going to be involved in the key area. That's what's exciting about this opportunity. There are starting to future problems. Just national government, so we won't go such together. That's the best of us people we do. That's how we involve in the that's what all schools are around. There are different like how we move forward, just national government, the league table goes, so all those bits that didn't need to happen, which take the focus away from all how we get happy, safe, healthy young people who will learn how, and ultimately at the end of the day, hopefully they lead to attention. But although it's in their just focus on it, which take you healthy and safe, how do we get to happy? For me, that's all we need to be on, and learn.
I'm definitely not down with politics.
Right. Lots of food for thought. Do people have any questions? Yes, we do.
I'm definitely not down with politics.
Right. Lots of food for thought from the panel. Do people have any questions? Yes, we do.
You're just going to have to wait for a microphone. That's okay.
It's not going to be a conversation. You use the microphone.
Hi, I was just wondering, apologies if this hasn't already been addressed, but thinking about early intervention, the lack of children's centres now seems to be really key in this. I was just wondering any approaches that they might be addressed, because it really is about early intervention both to children and to their parents. Children's centres now seem to be educating and thinking differently.
What a great question that is.
Any proof that they might be instigated, because they really seem to be making a difference both to children and to their parents as a vehicle for education and thinking differently.
What a great question that is. Yes.
I'll stop shouting now. So we are going to be reinvigorating, I think, really onto our family hubs. So having had 15 years of dismantling children's centres, we are going to reinvigorate our family hubs. So there is potential on the horizon to bring back some family hub activity. We know we've got a lot of work to do and it's not a lot of funding, but we certainly hope that but we can bring back some of that early years intervention that we had that was so great through Short Start Local Programme. And we're learning from Better Start Bradford in East, and we're going to follow their way.
There you go. There's not many panels that you come to where we describe all these terrible problems, and then out of nowhere we come up with a solution. Thanks, Joe.
We hope.
Right, so we have some more questions. I'm not sure the order. 1, 2. Well, you're next to the microphone. So the gentleman behind you, then you, and then.
I was just going to ask what the panel's thoughts on what central government could do in this space, especially around potentially things like regulation on social media or unhealthy food advertising and marketing, things that could potentially happen in relatively quick turnarounds.
Michael is going to answer that, and then Camilla's going to answer the question, but I'm going to ask her that question as well. If that's okay. She's also so Michael.
Bit of a sweeping statement, but when we live and promote a capitalist culture, environment of profit and taxes, then that's a plain simple fact of leading generations down the road of all the things that damage them. You know, this is it, isn't it? We do live to work or work to live. You know, it depends. But I think when it comes down to it, you can restrict social media, you can restrict advertising, but then that's democracy, isn't it? We're taking away people's actual freedom there, and that's something that as a nation we have always tried to promote from an equality, diversity, inclusion perspective. Also, equal opportunities, that's what we promote in Britain. And I think it's a completely juxtaposition of, if you're going to do that, well then, where's the line drawn with restricting? Well, these things that need to be done. Well, the failure is at the top because we want to get too political, because it's not what it's about, but it does come into play a hell of a lot more than it used to in our sector, certainly in current times. You have to look at these things about how we set up economically for profit and gain. Because that doesn't work in healthcare, does it? We don't do this for profit or gain, we do it because it takes care of our essential needs on a massive scale, I guess, rather than pharmaceuticals.
Okay, ladies and gentlemen, the next leader of the Conservative Party. Thank you very much, Michael. Does anybody else want to comment briefly on that?
I would just add that I think a lot of segregation is because of budgets. We're fighting in paediatrics. We fight for the budget against adult care, against and so we're always kind of fighting for our voice in that. And so if we are pushing off different elements of the pie, say that's the education budget, that's the social care budget, that's the health budget. Where's the child health budget in terms of let's all get together? We all want the best. I don't want 100% of the budget because I know that the best interventions are early starts or before schools or in schools. And so getting around the table and actually say, okay, maybe in central government we are divided in budget terms, in terms of our different teams, in terms of different departments. But on a local level, like Bournemouth and Bradford, like the opportunity area, let's pool all of our expertise, all of our input, all of our interests, and actually let's pool all of our budgets and think about this kind of blue sky thinking. Let's work together and see how we best use the budget that we have available.
Okay, thanks. The same integration that we're trying to do at the system level now in places like Bradford, across the country in integrated councils. We need a government level, and it is that challenge. The health economists have showed this early investment pays off dividends, but we just can't seem to do it. Okay, so we're going to take this lady here, then Camilla, and then the lady over there.
Oh, to work for this gig.
Hello, I'm Julie, one of the district councillors for Bradford. If I was the leader of Bradford Council, what would you say to me that I need to do to meet what you need?
Okay, so taking the question before, being on a local basis, who wants to answer that?
I'll take it.
Yeah.
Collaboration. Yeah, there's sectors that are collaborating brilliantly, and the pandemic was a very challenging time, but the work the CARE research project did around bringing schools, health, and everyone together was a real benefit through the pandemic. We were going through unprecedented times. The information about schools, we were back in very quickly, and it was that what it brought together was really positive. And I think that collaboration needs to work across systems, across health, police, fire, everything. Bring it together. If we can work together, then we've got got a chance of really making a difference. So forever it's being pulled in different directions, different organisations, different budgets. It's not going to be efficient, and I think that's where we've got something that half works, but half works is not good enough. If we can work together collaboratively, then that will make the biggest difference for me. And that, as someone that's been working in Bradford schools for just over 3 years now, would be the point I always make, and I've made it to the leader of the council. They don't often want to hear that, but I'm happy to say it because it's about how do we get better at what we do, because ultimately we all want to make a difference for the people we serve, the young people we serve in our case, and if we can do that, that's going to have better outcomes for them and their families.
Thank you. So Camilla, have you got a microphone? No.
Can you pass that back?
Can I, rather than
So Camilla, you can ask a question, but you've also listened to some of the,
Yeah.
what are the policy implications locally and nationally? What, you're in this wonderful position of, everybody tells you what to do, presumably.
Oh yes.
And you've got all this sort of wisdom that you've accumulated. What's your sense of what we should be doing?
So I think obviously as a medical Royal College, we come from a perspective of health. But I think we've learnt an incredibly important lesson during the pandemic. And it's been a very cruel natural experiment about when you take apart the education system, you don't allow children to mix with each other, clearly go to school, take advantage of sport, etc., etc. I mean, I think, the kind of gloomy description you were giving just now, I think, and I don't need to rehearse that. So I think what we have learned in the health sector is that never again can we afford to think of children through a medical lens. We have to think about, we endlessly theoretically talked about the biopsychosocial approach to child health, but my goodness, have we learnt this in the sharpest possible sense. And so I think it's really about taking that forward. And what's really interesting, actually, is that in conversations with colleagues in other areas of health, adult physicians are starting to say, actually, we need to think about the frail elderly in the same kind of way. And actually, I've been having some really interesting conversations about, could we pilot some things in child health that could be then extrapolated to the wider population? Because actually what we're talking about isn't unique to children. I think we're here to talk about children, but actually all of us want to be thought about in the round, not just as health or what. So I think we've got some really important lessons that we can capture as experts in children's health and well-being, but that we ought to be able to roll out across society. But I've got a question for the panel, if I may. So 1 in 3 children live in poverty in this country, and we are about to go into a really, really challenging winter with a escalating cost of living crisis. So paediatricians on the front line are telling us that they are incredibly worried about how to actually engage with families around these sorts of topics, like can you heat your homes? Are you using food banks, etc., etc. So we're developing a series of resources to essentially equip the child health workforce to more confidently work in this space. And so what I would love to know is from all of you is what should we be putting in our toolkits to give frontline child health workforce this winter to do better by our children, given the huge issues around poverty?
Well, I'm going to start with Matt.
It's a huge area, isn't it? And it's not easy to answer. I think in Bradford, so what we're doing this winter is we are asking questions for the first time about social history. So as part of the medical history, we do ask questions about the child and the context the child lives in, but it's usually quite cursory. We don't really ask about poverty. We don't ask about missed meals. We don't ask about medication that can't be accessed. We don't ask about access to travel and to money. But we're hoping that this winter we will start asking those more in-depth questions. And I think, Camilla, you are alluding to the WHAM website. Actually, that CARE, who's organising this event today, have got a link to. And it's about sort of what's happening in local communities, social prescribing, and actually referring children who are in need and families who are in need to lots of amazing stuff that's going on in local communities, not health, but in the third sector and other sectors, just helping some of the most vulnerable families get through this winter. I think in terms of planning for the future, I think that's a real discussion amongst paediatricians and educationalists and social care about how we get through next winter and the winter after that. This is not a new problem. It's been highlighted by COVID, but it's a problem that we need to deal with across the system, and use all the the agencies that we can mobilise.
Any other brief? I would put benefits advice into your toolkit.
Yeah. Any other suggestions?
So I would say that the WAM portal was born from quality improvement projects that were set up by junior doctors working in their local practices who saw a need but didn't know what to do. And so the screening tools and the kind of signposting that were developed were done locally. So they just Googled their local council website and got a link to their children's and families page. And so as part of their normal history taking, they were saying, who lives in your household? Do you know where your next meal is coming from? Are you struggling with your health? It was a kind of the part of the normal history taking, and it didn't seem completely out of the blue because it's saying, and families that were asking, the junior doctor would say, this is what I ask every family that I see in A&E, every family that I see in clinic. And actually, what was stopping some junior doctors from doing that was because they felt like they didn't know what to do when a family said, actually, I don't know where my next meal is coming from. And then you think, oh, well, I don't have anything to actually signpost to you or kind of guide you or support you to. And then these junior doctors were producing these posters, so they had local links of local community fridges, local community third sector organisations. So they were directly referring the families they were seeing in A&E to these local organisations. And these local organisations were struggling to get funding because it felt as if no one was using them and no one was engaging with them. So it was this kind of two-way partnership. And that's what we're encouraging in terms of paediatrics this winter, in terms of the WAM portal and all those kind of things, is actually do include this as part of your normal history taking.
Okay.
Find out what local resources you've got and then make sure you've got those links together.
Okay, really nice idea, sort of 21st century social history, which dropped a little bit in clinical practice, I think. So John, from a school's perspective, and then we'll ask the lady.
Bradford's a very diverse place, so I would say make your literature, your information resources open to the 130 languages that people speak, because the biggest issue we have, and we serve a very diverse community, is that it alienates people straight away. And if they can't access it, they can't have that opportunity, they don't know about it, and straight away that sort of compounds the problem. So having it available and getting the right partners involved, going to some different community groups, the mosques, going to them and saying, look, how do we help, and working with them, because for us, Calling Keithley, one of the first meetings I had was with the local mosque. How do we engage? How do we get our community on board, and how do we work with them? With that became the support, and they buy into everything. But we've got such a wonderfully diverse city. We need everyone to understand what's available, because what I do know is that working with a number of those groups is sometimes they don't realise they're living in poverty. And what looks like poverty to us might not be to them, and actually they don't realise the opportunities out there to help them.
Okay, good. So we've got a lady over there and a gentleman over there.
Hi, I just have an observation. So I'm from NHS England and appreciate the reference to integrated care systems, John. Thank you. I'm part of the system transformation team, so we've been working very closely to kind of bring that policy to life. And one of the things that's really struck me recently is Claire Fuller did a stock take of primary care and described neighbourhood level working really closely together in different ways. And I'm just wondering, listening to you all, how do you think, as a panel in Bradford, we could consistently get that neighbourhood working going, where you actually have neighbourhoods really tackling those problems?
I had this same conversation this week at a focus group actually, and made the point that we don't tap into youth services enough in the district, and that some of the ones that I've been to recently have been absolutely overwhelmed with young people attending and don't have enough staff, but could do a lot more, and we can work with them, because outside of an education setting, children are either at home, let's face it, after school clubs, on the street, or should be, like some of us may in this room, be at the youth service where they can engage in activities, they can be fed, they can also shower at some of those facilities, they can engage in sexual health advice, all these things that they can't have a conversation with the parents about because of a generation gap, and also the shame with talking to the peers, but they can talk to a youth worker. And I think they're an untapped resource that we all need to start just doing a little bit more collaborative work with, really, in not so many ways.
It's a good question, particularly for young people, because I think there's a big gap there, actually. It's something that we need to really focus on. So I think we're going to have one more question, and then we've got to all huddle around the cooler. Just to calm down a bit. Gentleman at the back.
Hi there, yeah, I'm Simon, I'm an MAHR researcher from the University of Leeds. I was really pleased to hear you talking about how schools should focus on the holistic needs of young people more so than the academic outcomes, and the academic outcomes will come as a result. I wondered if you had any ideas about how schools might be able to dial down the focus on those kind of academic outcomes to free up time and capacity for school staff to attend to those more holistic needs.
John.
Yeah, that's like the golden bullet. That it's a real challenge because you have to be creative in your curriculum, and what for schools, depending on their size and the capacity, can affect that. So I have a very large school and then quite a small school, and actually the ability in the large school is that I can have a massive range and flexibility that I can't have in my small school. Yet in the small school, everyone knows everyone better, and it's so to try and get the level of sort of care into that. I think it's a creative system trying to develop that. You know, as an academy trust, I don't want to go too much about the trust agenda, but for academy, we get greater flexibility around what we do, and that allows us to sort of meet the needs of some of that, because there is a challenge. Our parents very clearly are asking for their young people, and sacrificing some of that for their well-being and their happiness isn't necessarily on the list. Yet if you read the PISA study or you see the big ARC survey results, 1 in 4 children don't have a sense of belonging. 1 in 2 in a socio-deprived area is even worse. And so we've got to prioritise some of this, and how we get it into our school days and our school lives becomes part of your culture rather than add-ons. And I was at a youth sport trust event last week about becoming a world trust, and it was about no fireworks. It's the culture you live and breathe and how you look after the people within it, rather than the chocolate bar say thank you. I do the chocolate bar, we've done it, but actually it's about how you culturally change. So in terms of those activities and what you prioritise, it's about promoting them. The impact always is cost, and we've spent a significant amount of money developing this for a full launch next year, that every child gets access to trips and activities for no cost whatsoever. But we've had to make sacrifices to be able to get there. And so as an organisation, we've got there. And I know working with our school leaders, that's not always the case. Budgets aren't always the same. If you've got a roof that's falling down, that takes priority over taking 500 kids to the seaside to learn about the seaside and the sort of economy that goes with it, and geography with that. So it is a real challenge, but it's about being creative, but working with partners. You know, the reason why we're here today is we say yes to everything. So when I was out there, I've got about 5 other projects we've said yes to today. My head's going to kill me, but it's what it leads to is so many connections, and there's many people in the room that I've met, connected with, worked with, and it is about that collaboration. If you can do that, then you can come up with the answers, because no one's going to give you the answers. You've just got to try and find it, work with the amazing partners around the district and area, that will help you. Thank you.
Okay, that's it, folks. I think we need to give the panelists a virtual chocolate bar for their contribution today. And by doing that, celebrate with some fireworks from applause in terms of their... Thank you for not melting during the panel. For those who want to stay on, the next panel here is Creating Neurodiversity Friendly Schools, really important topic at the moment. Ava Green is going to be chairing that. For those who are doing something else, I've got no idea what's on the panel, so I'm the wrong person to ask. But thank you very much for listening.